So who would agree with me that psychedelic therapy is psychotherapy? Okay, then I can go home already. Everybody's already convinced. So maybe I can still present some arguments for this. So this is a suggestion that I'm making. I'm not going to present conclusive empirical evidence for it, but rather I will present the idea. Yeah, and this idea is based on two assumptions. First assumption is psychedelic therapy works via experiences that are therapeutic. And the second assumption is that these experiences drive the same change mechanisms that underlie the efficacy of all effective psychotherapies. This here is perhaps the most best replicated non-trivial finding of psychedelic research. The psychedelic experience mediates between the drug intake and the longer-term outcomes. These are just three examples. This is the 3 different studies with, I think, depression, nicotine use disorder, and anxiety associated with terminal illness. And all these studies show that the so-called mystical experience predicts longer-term improvements, symptom changes. Just an example. But the mystical experience is not the only important aspect of psychedelic experience that have therapeutic relevance. There are also all kinds of other experiences. This is not a conclusive list. These are just some examples of other aspects. So emotional breakthrough experiences, acceptance, avoidance-related experiences, different kinds of insights, challenging experiences, and so on. The list could be longer. Yeah. But also, it's important that not all aspects of the psychedelic experience, or also not the psychedelic experience by itself, is important from a therapeutic point of view. Yeah. So this is from a recent study from Switzerland. They tested psilocybin for depression. They found psilocybin therapy to be effective. And they also correlated various aspects of the self-reported psychedelic experience with longer-term clinical outcomes. They used the ASC, the Altered States Consciousness Questionnaire. Very broad measures things like changed meaning of percepts, synesthesia, disembodiment, spiritual experience, blissful state. Very, very broad measure. And actually most of these experiences, or most of these measures, are not strongly related to therapy outcomes. Some are, and the one that's most strongly associated with outcomes here is insightfulness. Yeah. Does this work? No. Yes. Here. And I think it's not a coincidence. Yeah, that insightfulness of all these things is the one that is also most obviously related to psychotherapeutic processes. Yeah. So what do we take from this? First, the overall intensity of psychedelic experience is probably not per se therapeutic. This is sometimes assumed by pharmacological researchers. And we can also take from addition to the psychotherapeutically relevant aspects of the psychedelic experience. For that, we must understand or have a broad understanding of how psychotherapy works. So how does psychotherapy work? Like this? Oh, yeah, I can hear myself now. Right, great. So how does psychotherapy work? Oh man, this is impressive. Yeah, thank you. Please repeat if it happens to me again. Then, yeah. So yeah, how does psychotherapy work? You may ask, what psychotherapy? There are many different psychotherapies. Which one am I talking about? And I'm different psychotherapies. They use very different methods. You look at things like body therapy, music therapy, psychoanalysis, cognitive behavioral therapy. Quite different on the surface, but according to psychotherapy research, the change mechanisms that underlie these different approaches are probably not so different, or in fact, actually the same. The different models of common factors in psychotherapy research, the idea that there is such a thing as common factors of all effective psychotherapies is almost 100 years old. Many, many models have been suggested. They're all, or mostly, compatible models. They're not competing models. These are also just examples for influential models of common factors. And I will focus on this one here, Grawe. Coincidentally, a German psychotherapy researcher. Yeah, could have to do with that I choose Grawe here. It's very influential in the German-speaking countries. But another reason to choose his model of general change mechanisms here is that it's a model that focuses a lot on change processes and on experiences. So it looks in a very detailed way and describes in a very detailed way the psychological processes that are associated with psychotherapeutic experiences. And in psychedelic research, we're also, of course, interested in experiences. So I think this model fits very well. And Grawe, he identified these 5 general change mechanisms empirically based on, I think, something like almost 1,000 process outcome therapy studies. And the idea here is that these are really what underlies effective psychotherapy, irrespective of the kind of therapy. Yeah. And I will just walk you through each change mechanism now. Yeah. So problem actuation, in the plainest language possible, this means to engage with feelings that one would otherwise avoid. Yeah, I think we can agree that this is something that all effective psychotherapies do. Thank you very much, Mr. Yeah. So there are some overlapping constructs in psychedelic research, the challenging experience, for instance, perhaps also avoidance-related experiences, re-experiencing adverse life events. Let's look at a patient report from the episode study. So in Berlin and Mannheim in Germany, we're doing a phase 2 trial with psilocybin for depression. 144 patients. I think we finish this December. In a few weeks, we will have included the last patient. And here's a report from a qualitative interview of one of those patients. This patient says, I'm just going to read it. It's just been a very, very intense way of dealing with my emotions without being able to build a protective wall. I think psychotherapy or psychoanalysis serves to strip away the protective walls, layer by layer, to get to the core. And that just went a lot faster with psilocybin. I got to the core much more quickly, and as a result, I was also much more unprotected. I like this quote here because it's ambivalent. So it shows a great potential of psychedelics for problem actuation. It also shows some obvious risks. Yeah? So do we want completely unprotected patients? And if so, under what circumstances is it a beneficial thing to be completely unprotected and to go to the things that people have avoided perhaps their whole life? Yeah. Let's look at a related construct of challenging experience. Challenging experiences occur very frequently in psychedelic therapy. There's no clear statistical relationship between challenging experiences and long-term outcomes. Yeah. This is just one example of a recent study where I think, depression, psilocybin for depression, they did not find a statistical relationship at all between challenging experience and longer-term outcomes. And this kind of represents the research on challenging experiences. Some studies find positive, some studies find negative outcomes. And this really points to the fact that challenging experiences, they can be a lot of things. They're not necessarily problem related. Yeah? So you can just have a challenging experience. Doesn't have with the psychological problem that you have. Yeah? So there is a difference between the challenging experience construct and the psychological process of problem actuation, yeah, in psychotherapy. So problem actuation, on the other hand, can be challenging, but it's also not always really challenging, depending very much on whether or not the person is able to bring acceptance to a problematic aspect of their experience. They will not have a challenging experience at all. Yeah. So I said the problem actuation, when is a good time to do that with patients? In psychotherapy, and by implication also in psychedelic therapy, it should always go along with resource activation. This is a second general change mechanism. This refers to the process of developing positive motives for change that serve the fulfillment of basic psychological needs. Things like orientation, control, attachment, pleasure, self-esteem. Yeah. There are some constructs that overlap, again, mystical experiences. I will explain that a bit more in a second. Experience of connectedness, insights about positive goals and adaptive patterns. Here is another episode patient. I saw my true self, person that I really am, that I'm actually an active person. I like to move, I like to be loud sometimes. Not always just this holding back and being quiet. I actually like to do things and be with other people. I always thought I was just a person who prefers to be alone, and that's not necessarily the case. I'm also not as cold and heartless as people might think. I'm more of a warm person deep down. I'm actually a person who just likes to make shenanigans or play around. I've just always suppressed that. Now I'm trying to learn to allow it. So this seems to be a description of a resource activating psychedelic experience. Patient gets in touch with a part of themselves that they actually like, that is associated with, seems to be associated with positive motives, positive goals. And this experience seems to create a motivation. Says, now I'm trying to learn to allow it, trying to work on themselves. So how about mystical experience? This is another patient report from a qualitative study. They also did quantitative analysis in an experimental study with healthy volunteers. So this qualifies as a so-called full mystical experience, something like 70% or so on the mystical experience questionnaire. There is actually a definition for that. Yeah. And this patient says, the feeling of joy and love was the energy in the universe, completely intense, multiplied by 100. It was like taking those two emotions, concentrating them, to have them in their purest form without any worries or other troubles that can come with everyday reality. Everything else ceased to matter while those two emotions were so pure. They made everything incredibly beautiful. When I was soaring through the sound waves with this energy, I could see all the people close to me in my life appear. My partner, my sister, her boyfriend, their newborn son, my mother, my amazing friends. I felt immensely privileged to be part of this universe, community, to be able to feel those feelings in such a pure form, to have such deep emotions in my body. And I was overwhelmed with gratitude for this world, that everything simply is. And with that, I was overtaken by a desire to protect it all, to show the world how beautiful it is and to take care of it. Sounds familiar? Yeah. So I like this example very much because I think it's quite representative of what mystical type experiences look like. And it also shows that they do not occur somewhere out there in the universe, yeah, but they actually have to do with people's real lives. Yeah? So let's take a look at a psychotherapeutic look at what is going on here. So we see a transient inactivation of all kinds of avoidance-motivated mental activity. Yeah. So this person speaks of worries, things like negative emotions that they experience in everyday life is not playing a role here. A strong activation of the approach motivational system, intense positive emotions, deep fulfillments of all four basic psychological needs, orientation and control, everything else ceased to matter. Yeah? So this is a sense of absolute orientation of what matters. Attachment, obviously, pleasure. And also, if you look closely, there is indications of satisfied self-esteem here. Yeah? I felt immensely privileged, and so on. Yeah? And then I think the most important part, here in bold at the bottom, there is an emergence of an approach goal. Yeah? The experience is not just happening and then it's over, but the person really seems to derive some positive goals from it, yeah? To connect to other people, to protect the world, take care of things, and so on. Yeah. So this is really the essence of a resource activating experience. Yeah? Although it may seem like something that doesn't happen in this way in everyday psychotherapy, the underlying mechanism seems very much the same. This I've shown before. Clarification. So when resource activation and problem actuation coincide in therapy, then people can have sort of corrective experiences. This model distinguishes two types of corrective experience. The first one is clarification. Clarification, gaining awareness of unconscious motivational or motivational emotional patterns, learning to recognize, understand, and question them. So if you're a psychoanalyst, for instance, then you might note that, yes, this is what real psychotherapy is. Yeah. We have some overlapping constructs again in psychedelic research, insights about avoidance, maladaptive patterns, emotional breakthrough. Here's a clarification experience from a patient from the episode trial. In retrospect, I think my depression was due to my deep self-loathing, self-hatred, lacking or non-existent self-esteem, lacking or definitely non-existent self-love, and then just self-hatred as an extreme manifestation. I think almost all of my symptoms can be traced back to that. When I couldn't love myself, when I couldn't respect myself, when I couldn't appreciate myself, I didn't have the idea that other people could appreciate me. And I think that was one of the reasons for my fear of other people. Ever since I started to feel that I'm valuable myself, that I'm valuable to myself, I accept much more easily that I could be valuable to other people as well. And I think that's the whole crux of it, as far as social things are concerned. By the way, this is the same person who had the resource activating experience. Yeah? Maybe you can recognize the connection here. Yeah? The person who discovered that they actually like to play around and have shenanigans and not stay at home all the time. Yeah? So this also illustrates not only the kind of bringing awareness aspect, but also the kind of understanding and questioning. Yeah? So this person understands, becomes aware of an avoidance pattern, and then contrasts this with their actual resources that they've also discovered. Yeah. Clarification in psychedelic therapy. This is from a psilocybin trial, comparing psilocybin versus escitalopram. And they found, unsurprisingly, again, like the Swiss study that I showed before, that psychological insights predict the therapy outcome. In this case, changes in rumination symptoms. Pretty strong correlation. Next change mechanism, mastery. Learning new abilities for handling difficult feelings and challenging situations. So now if you're a behavior therapist, you can say, yes, this is what therapy is really about. Yeah. Overlapping constructs again in psychedelic research, emotional breakthrough experience, acceptance-related experiences, self-compassion related experiences. Here's another patient. Then I was able to apply what I had learned before. So this patient is explaining a challenging experience that started as a challenging experience that then resolves. I'm feeling this now. Why am I feeling this? I don't know, but I just look at it and let it flow through me, and then we just see what happens. And that was always right in every way. I mean, even then, I still experienced some dark minutes, but I no longer felt helpless about that. That was hard for me in my depression, that I could not do anything against the darkness, the negativity, because I always thought that and that turned out to be an illusion. I didn't have to fight at all, or have that one clever thought, or cut the Gordian knot, or have someone else come save me. All I had to do was look at it. Such things can also be read on Facebook and in calendar books. But when you've really experienced it, that's something else. Experiencing is just a different quality. So a psychedelic mastery experience. Again, from the psilocybin versus escitalopram trial. So this chart here is from the supplementary materials. This shows all the outcome measures of this trial, comparing psilocybin versus escitalopram. And the strongest difference between the two treatments they found regarding avoidant coping strategies. So apparently, this seems to be a specific treatment effect of psilocybin compared to SSRI. And it probably can be best explained by mastery experiences. People learn to cope differently with strong emotions, with difficult situations through psychedelic experiences. Here's a model that some colleagues and I came up with that theoretically explains how people can learn mindfulness, things like mindfulness or acceptance in psychedelic states. Yeah, I will not explain the whole model now, but the basic idea is that psychedelic states can, under favorable circumstances, can motivate acceptance by sort of rewarding it, rewarding letting go, and kind of also gently, or perhaps not so gently, punishing avoidance. So I recommend reading this paper. We also have a questionnaire that is supposed to measure this process, and also the opposite. We also believe that under less favorable conditions, people can actually learn something else. They can really learn without a mastery experience, that difficult feelings, difficult memories actually seem to be unbearable. And then they come out of an experience with more avoidance or strengthened avoidance-related beliefs. Yeah, the last change mechanism, therapeutic relationship, perhaps the most important one, working together on the basis of mutually agreed therapeutic goals and positive emotional bond. This is a very important study here on the right from last year. There are very few studies that take constructs from psychotherapy research and apply them to psychedelic research. Psychedelic and psychotherapy research, although they sort of belong together, they barely touch each other. There's no, or hardly any engagement or mutual exchange. So this is really an exceptional study. They just took the construct of therapeutic alliance and measured it in a psychedelic therapy trial. They measured the therapeutic alliance one day before the dosing session, and this predicted rapport. That's kind of so the therapeutic alliance is a therapeutic bond, an emotional bond. It's also agreement on goals and tasks in therapy, shared intentions for change between patient and therapist. So that's the alliance. The rapport is more like only the emotional quality of the emotional bond. So report on the session day, and that in turn predicts emotional breakthrough experiences. Or in the language that I would use as a therapist, problem actuating experiences that are combined with clarification or mastery in the psychedelic state. And this in turn predicts reductions in depression symptoms. Very important study. Here's another episode patient speaking about the therapeutic relationship. I will never forget the two hands, Mrs. X on the right and Mr. Y on the left. I will never forget how the hands held. I asked them to help me through this now, and they did not leave me alone. And I asked them not to let me off the hook either, I wanted to get through this. is the way out of these negative images and this shame and these self-destructive thoughts. I asked them not to let me escape, and they didn't let me. Mr. Y was strict with me, but he was very, very good. And Mrs. X was very loving and kind to me. And she gave me the feeling that what is happening right now is good. So I think this shows that it's a bit more here. We're not just speaking about trip sitting or psychological support here. Thank you very much, Mr. Yes. But a real therapeutic relationship. When you read closely here, there is not just holding hands and not just kind of calming down or reassuring, but there is actual work. Yeah, there seems to be a shared intention to go through something difficult and to work on something. Yeah, with two professionals who, I think it's also important to say at this point, who also know boundaries, yeah, related, for instance, to therapeutic touch. Yeah, at this point, I think it makes sense to mention that this model here is of course a simplification. Yeah. So far, we have neglected the important role of context factors, or set and setting, yeah, immediate context factors, the immediate situation where an experience takes place, and the superordinate context. Yeah. In the case of psychedelic assisted therapy, this would include things like preparatory sessions, integration sessions, yeah? An active attempt to shape the context for therapeutic experiences and also for beneficial longer-term integration. So these photos here, they're from the APT program where we practice this together. There's also a very simple hypothesis here that is to be tested in future research. So you can see here just the commonplace general change mechanisms of psychotherapy. They can occur in the psychedelic experience. Yeah? That's the idea. And I would hypothesize that they're much more likely to occur when they have already occurred before in preparatory sessions. Very simple. So with this model, we can create a continuity, yeah, between throughout the complete therapeutic process. Yeah? Not have a therapy and then a psychedelic experience that is completely alien and different, and then have integration that is again disconnected. Yeah? So I think there is a real value to having this kind of theoretical integration. Yeah. And of course, it should be tested in the future. So what do we do at Mind to connect psychotherapy research and psychedelic therapy? Practical implementation. This is the APT program, English and German language. Theoretical integration, there's some books, some papers that we have written and that we continue to write. There's qualitative research in the episode trial. So the episode trial is, of course, first and foremost a clinical study that will yield quantitative data on the efficacy of and safety of psilocybin for depression. But there's also a large qualitative study going on in this trial. We will interview about 100 patients with a focus on psychotherapeutic change mechanisms. And then quantitative research. Yeah, with these questionnaires here, I just want to mention the avoidance acceptance related experiences questionnaire that we developed. And then the general change mechanisms questionnaire. This is a questionnaire that is supposed to measure these 5 change mechanisms in the context of psychedelic therapy. Yeah. I will, if I have time, I will show a few data with that questionnaire still. So I have presented a few arguments for why I believe psychedelic therapy is psychotherapy. Of course, psychedelic therapy is also a pharmacological therapy. There is a biological perspective or a neuropharmacological perspective. These are just 3 examples of possible change mechanisms viewed from a more neurobiological angle. And again, I think it's important to mention that these are not competing models. They're very much complementary models, or kind of 2 sides of the same coin, yeah? Biopsychosocial model. as such a biopsychosocial model of psychedelic psychotherapy. They can be sorted into a kind of typology. So there's sometimes an objection of biological reductionism. We should just ignore the psychosocial aspects and just look at the neural stuff. Yeah? Or the opposite, yeah? Psychosocial reductionism. We can just ignore the biology. Yeah? This is perhaps less famous, but it also exists. Then in the psychotherapy field, there's a lot of traditionalism. People say drugs, especially drugs of abuse, cannot therapy. Then there is tremendous tribalism in parts of the psychotherapy field. Only my own preferred brand of psychotherapy provides a valid approach to psychedelic therapy. Yeah. In the psychedelic field, exceptionalism. Psychedelic experience is too special or too sacred to be accommodated by such profane theories. And then the last one is my favorite one, magic bulletism. Why bother building theories anyway? Psychedelics are so inherently good. They will just solve all of our problems anyway. Yeah. And then I think the most important one is there is an objection of constructive scientific skepticism. People want to see the evidence. So how to measure channel change mechanisms in the context of psychedelic experiences? So there are, of course, instruments available to measure these 5 change mechanisms in standard psychotherapy. The problem with those is that they don't work very well for psychedelic therapy. If you just look at this scenario here, the patient is wearing eye shades and headphones, they're lying down, there's not very much interaction. In fact, this holding hand, we just did it for the TV camera. It happens in the trials, but it does not happen all the time. Yeah? A majority of patients never holds someone's hands during their psychedelic experience, at least not in my experience. So there's very little interaction. There's not a lot of spoken language. And when a patient has a therapeutic experience of this kind here, they may not necessarily attribute it to some action of the therapists. And the measures we have already established for measuring change mechanisms in standard psychotherapy, they're often formulated like, today my therapist touched my sore spots, or today my therapist used my strengths to progress in therapy. Yeah? And obviously those items don't work for psychedelic research because people have such experiences, but they're not necessarily attributed to the therapist. They may be attributed to the general situation, to machine elves, to the psychedelic drug itself, to God. Yeah, we don't know. So we just have to build new measures for measuring change mechanisms in psychedelic therapy. So we developed a measure. We did an online survey to validate this measure. We recruited people via social media, newsletters, and so on. And then we asked people to report on a memorable psychedelic experience in the last 5 years. We asked about context factors like setting, use motives, and then psychometrics to describe the experience, including the general change mechanisms questionnaire that we developed. And we also asked about current well-being and stressful life events. I don't think we will get to that last part, but I want to show you some interesting findings from this survey. So this is a large sample, almost 1,900 participants, relatively young people, mostly male people. That's a thing in psychedelic research. Males, they take more drugs, and they also like to talk about it more, I think. Relatively highly educated people. About half of the participants used LSD, the other ones psilocybin, bit of ayahuasca. Most people follow harm reduction recommendations, yeah. 84.8% in calm, undisturbed environments. This one is important here. Setting design 90% of people would agree to that item. Yeah. So this could be people who participated in research studies, but also in underground therapy or perhaps in medicinal ayahuasca sessions, things like that. Yeah. Yeah, then most people, I think this is also important. The retrospective appraisal, the overwhelming majority of people say that they report on positive experiences that they are glad that they have had. This could be just the case that most psychedelic experiences are like that, but it could also be that those who have horrible experiences that they learn nothing from, they're much less likely to participate in research like this. Yeah. So these are the items. I don't think we should we? Maybe let's not go too deep into the individual items, but what we see here are the items. And we can also see here that the therapeutic relationships scale is missing because this is not a therapy study. So we could not test this scale really. We find a hypothesized factor structure for this measure. And now comes the interesting part. So how do these experiences, these kind of psychotherapy-like experiences, how do they relate to standard psychedelic measures? Yeah. So now oceanic boundlessness is a subscale of the Altered States of Consciousness questionnaire. That's pretty much the same as mystical experience. MEQ and ASC, oceanic boundlessness, they correlate almost perfectly. So this is mystical experience. So mystical experiences, they're related to resource activation. They're not so much related to the problem-related part of psychotherapy. Yeah? So these experiences from a psychotherapeutic point of view, they're really much more about, thank you, about developing positive motives, yeah? And not so much confronting problems and working on them. Challenging experiences seem to be moderately related to problem actuation, but not too strongly. And this again makes sense, yeah? Because problem actuating experiences can be challenging, but don't have to be. And challenging experiences can be problem related, but also don't have to be. So this is expected. Then emotional breakthrough. Again, this is kind of the opposite of the mystical experience. Yeah? Not so much related to resources, but more on the problem side, yeah? Problem-related experiences. Confronting difficult feelings, finding clarification, mastering difficult experiences. This is emotional breakthrough. Another thing I think that has a lot of clinical relevance is the intentions. So we measured also people's intentions for undergoing the psychedelic experiences. And these are therapeutic intentions. These are things like taking psychedelics to overcome a mental disorder, or taking psychedelics to work on emotional problems also. Yeah. These are unsurprisingly positively associated with all four change mechanisms. Then hedonic intentions. This is more like taking psychedelics for fun in an approach motivated sense. Yeah? To have fun, to be creative, to spend time in nature, to spend time with friends, for sexual pleasure. Yeah, those are the items in this scale here. And this seems to be more positively related, slightly with resource activation, and negatively related to the other more problem-related processes of psychotherapy, which also makes a lot of sense. And then I think this one is especially important from a therapeutic point of view, escapist intentions. Yeah? So these are avoidance motives for using psychedelics. Things like taking psychedelics out of boredom, yeah? Or to fit in, or to forget about problems in everyday life or so. Yeah? And these seem to be positively associated with problem actuation and negatively associated with resource activation. And that's a bad problem actuation should always go along with resource activation. Yeah. When a patient comes to me with spider phobia, I don't throw the spider in their face in the very first moment without really activating the resources first, yeah, so to say. So in therapy, I think extrapolating from here, we should really pay attention to the intentions that people come in with and try to shape approach motivated and therapeutic intentions. So what about settings? Therapeutic settings. So I don't know. Yeah, this is from Johns Hopkins. Maybe some participants were in a trial like this, but it could also be that people were in underground therapy or doing therapy, kind of therapeutic psychedelic self-medication at home. In any case, this is positively associated with all change mechanisms. Party, concert, festival, negatively associated with all therapeutic processes. This is interesting now because what? I had such a great party experience. Yeah. We have to keep in mind here that this is relative, relative to the other settings that people report on. People have less therapeutic experiences, less psychotherapeutic experiences on festivals, apparently. This doesn't mean that they don't have other valuable experiences there. And then this one I like especially, nature. So in nature, people report more resource activating experiences and less problem actuating experiences. And this is clinically, or might be clinically useful. Yeah, if we think about the fact that psychotherapy research very clearly shows that resource activation is important in the start of therapy, yeah, and also in the start of therapy sessions. As I said, yeah, you don't throw the spider in the face the moment the patient comes in. And in psychedelic therapy, with this setting here, it's really hard to steer, in a way, what kind of therapeutic processes will come out. So from this result here, we could take inspiration, perhaps, for future studies, maybe starting psychedelic therapy, doing a first session in nature. And then only later, after resources have been thoroughly activated, coming to this more introspective, more problem actuating setting. Yeah. And this is actually, I think, is a kind of the future of, or one part of the future of psychedelic research, is to systematically vary setting factors. Yeah, this could be the setting, like nature settings or so. It could also be more kind of psychotherapeutic variables, psychotherapeutic interventions that are geared to specific change mechanisms, and then see how that relates to specific therapeutic processes in the psychedelic state. Yeah, summary. So I argue that psychedelic therapy is psychotherapy because it's based on experiences and because these experiences are very much related to general change mechanisms of psychotherapy. There is almost no exchange to date between psychotherapy research and psychedelic research. And I believe we can benefit this field a lot by drawing links, drawing more links and connecting these fields together. And the ways this can be done is theoretical integration, something that I've tried to do today, and also research instruments, of course, to bring together the knowledge from these fields. Yeah, not least, the view that psychedelic therapy is psychotherapy has important implications for research and regulation. Yeah. So there's the question, do research organizations and also regulatory agencies really have the necessary competencies to investigate something like psychotherapy? And which professions should be allowed to provide this therapy? And how should psychedelic therapists be trained? I show this here, Goodwin. This is the medical director of Compass Pathways. Recently had this paper that caused, I think, a kind of a shitstorm in the psychedelic world, asking, do we really need psychotherapy with psychedelics in psychiatry? This is sometimes misunderstood by people agree with him who say, yes, I took psychedelics at a festival and it was great. So And obviously, this is a misunderstanding. Yeah? So we're speaking about psychiatric treatments for mental disorders here. And the question is, should those be conceptualized as psychotherapy or not? We have a paper coming out, I think, in 1 or 2 weeks that will answer to this here. So I will just advertise this at this point here. Thank you very much.
Thank you so much, Max, for this keynote talk. We do have about 10 minutes for questions and comments before we have our coffee break. So I have a lot of my own, but I'll still let other people talk rather than ask them.
First off, thank you as always, Max. You're amazing. So good for this field. And I really agree upon that psilocybin should be conducted in a therapy setting. But how far-fetched should we go when we're speaking of pharmacological treatment together with therapy? I was thinking of ketamine, for instance. That ketamine that is being used as a biomedical treatment, but sometimes as a psychedelic treatment. What is your thoughts on like ketamine, and how long should we, or where should we draw the line where we combine pharmacology and psychology? Thank you.
Yeah, great question. So first of all, I think we could discuss this about any psychotropic medications, and I think it's a general problem in biological psychiatry that those two aspects of treatment, psychotherapy and pharmacological therapy, are treated separately, although they interact in so many ways. I think with classical psychedelics, it's most obvious. Yeah? One could say that the main effect of these substances is to induce context sensitivity. And then obviously the context is very important, right? And with ketamine or other atypical psychedelics, I think it depends very much on the model. Yeah, so ketamine can be used, I believe, in a way that minimizes psychedelic experiences and the integration of psychedelic experiences. And there may still be some more biological effects on neuroplasticity or things like that. I'm not a specialist in that. But I believe that depends very much on the context. So the Mind Foundation's clinical partner, Ovid, uses ketamine, IV ketamine, in a psychedelic model, off-label, of course. And it's a very thought-through model that prepares people and sharpens people's attention to pay attention to the experience that they will have. We also use this in the APT program, so the trainees undergo self-experience with ketamine IV in groups, and I'm always really astonished by how incredibly rich and extremely context-dependent these experiences are. So I think with the atypical psychedelics, it depends probably much more on how the treatment is conceptualized.
Thank you, Max. My question is two-parter, relates to setting as well as the fact that, like, the difference in psychotherapists, the outcome of psychotherapists differ depending on who does the work. Do you think there is some value in psychotherapists also having psychedelic experiences themselves? And what do you think, is there any additional value to psychotherapists taking a small dose of the substance during the session, as they do in underground, like therapy, for instance, and in traditional use? Thank you.
Oh, good question. Always comes. This question always comes. I think it's an empirical question. First of all, I think we should try it. The second one, I'm not so sure if what the ethics committees will say. But in principle, I think this should be researched more from a practical point of view. So I lead the APT program for Mind, and I do interviews every week with people who want to become psychedelic therapists. And these are all mental health professionals. Yeah, they're psychiatrists, psychologists, and so on. I've interviewed, I think, probably 300 people, and it's almost never in the discussions that we have in the committee to admit someone, it almost never is a relevant part of the discussion. Does this person have enough experience with psychedelics? Yeah. Just to give an impression of how we deal with this question, because that doesn't seem like really the most important thing. On the other hand, we very often have discussions like, I have the impression that a person is having an unhealthy relationship with psychedelics and psychedelic experiences, or certain forms of subcultures surrounding psychedelics. So I think that kind of discussion is a bit underrepresented in the discourse, whereas the should psychedelic therapists have tripped discussion is a bit overblown. Yeah.
Thanks for the interesting lecture. I would like to ask about resource activation. I am myself researching from a philosophical point of view the value changes that occur in psychedelics and afterwards. And I wonder, or that sounded very much similar construct to these acceptance and commitment therapy and psychological flexibility models and what they say about values. And I would, if you could briefly reflect the relation between values and this construct of resource activation. And also, would you agree that psychedelic psychotherapy and maybe therapy in general works, at least to some extent, by connecting individual to their values?
Yes, I would agree with that. If you look at the items here on the GCMQ, the resource activation items, a lot of that sounds a bit like values, right? Like things that give my life meaning, things that I'm thankful for, seeing oneself also in a positive light, positive motives in principle. So ACT, where the idea of values is pursued a lot in psychotherapy. I think ACT does a very good job at making clear to therapists that resource activation is essential, because the acceptance part of therapy is the basis of the commitment part. They kind of interact in a way that they belong to each other. You cannot motivate someone to accept difficult emotions when there's nothing positive to come out of it. Yeah. So I think the values construct is really the way ACT conceptualizes resource activation. Yeah. And then the commitment aspect of ACT is when I say the problem side, I mean problem actuation, but also the kind of the corrective experiences of clarification and mastery that arise when problem actuation coincides with resource activation. Yeah.
Okay, yeah. Thank you for the important presentation. I've been thinking about like how we know about psychotherapy studies, that how the relationship is so important. And then we know from the psychedelic studies how the set and setting is so important. So to me, it's a bit amazing that these studies don't really negotiate together so much, as you pointed out. But do you have some idea why is this so? Why don't this, it seems so important and kind of, yeah.
Yeah. Oh, yeah. This would probably be a talk of its own, I think. So some ideas for why psychedelic research and psychotherapy research are disconnected. I think there is a historical side to it that psychedelic research and psychedelic cultures is very much a countercultural thing. At least some currents in it are, and they seem to be sort of repelled by something as dry and conservative and boring as psychotherapy research. It's not exceptional at all, psychotherapy research. Psychotherapy is boring from a mystical point of view, perhaps. Yeah. Then there is an institutional or structural issue, yeah, because these are the studies are clinical studies with drugs. So the research takes place in not in clinical psychology departments. Yeah. So I think this might change after the substances have been approved and when it becomes easier to do research with them. Right now, I think the research is very much about proving safety and efficacy of minimal models. And it's not so much about optimizing efficacy and finding the best possible treatments. And I think that's when we will see a much more influx of psychotherapy researchers. Yeah.
Okay, I think we'll have to leave it there for now, but I'm sure you can catch Max during the breaks, and he'll always also be here tomorrow during the final panel discussion. But thanks once again, Max.
Thank you.